Thanks, Julian. All right, but I will go ahead and start. So good afternoon, everyone. Thank you so much for joining us today as we review important details of HPSM dental benefits. You have all been so supportive in helping us plan for this implementation, and we really appreciate all of your feedback and questions that have really helped us shape this presentation today. We acknowledge how important and groundbreaking this transition is, and we're so happy to have you all be a part of it and help to improve the overall health of our community. Any questions I'm not able to answer today will be followed up and answered, and I will update all providers. If you have any specific questions related to your practice, please reach out and we can schedule a quick check-in or phone call when you are available. And before I dive into these slides, I want to remind you all that this presentation will be available on our provider web pages by the end of this week. And I will also email everyone who signed up for this meeting a copy of these slides, and we will also have time for a Q&A at the end of the presentation. So without further ado, I'm going to get started. Okay, so here is our agenda for today. Pretty lengthy, but we'll get through it. First, we're going to go over who the HPSM dental team is, a quick credentialing and contracting update. We'll go over sending claims and pre-authorizations. We'll have a quick dental benefits overview. I'll talk a little bit about CalAIM and incentives that we're planning. We will discuss the referral process. I'm going to talk about Prop 56 payments, and we'll go over the provider portal briefly. And then lastly, we will have time for a Q&A. Thank you everyone who just recently joined us. We just got started and we're going over the agenda. So let's start with the introduction of the dental team. So myself, Marissa Cardarelli, I'm the dental benefits manager at HPSM. We have Gina Davalos here with us today. She is the dental access and referral coordinator. She just joined us last week, so she's getting onboarded. She also is currently with the HPSM, so she has a lot of experience with our members and working with our systems. Our other dental access and referral coordinator is Bernadette Navalta. She's also on the call today, and she will be joining us officially onboarded next week. She comes to us from UCSF, and she has really great dental experience, both clinical and administrative, so we're really happy to have her. And lastly, our dental director is still to be determined. However, we do have 2 finalists and we will make our decision by next week. Really great candidates that we have, and really excited to announce who our dental director will be. A quick credentialing and contracting update. We do continue to collect applications and outreach providers. This will be ongoing throughout probably the first full year of our pilot program. We will continue to credential and all throughout the 6 years. If you have any particular questions on the status of your credentialing applications for your providers, please email me or your credentialing specialist, Paul or Trey Share, for an update. And then lastly, for electronic funds transfer form, I'll be reaching out to all of you just to make sure we have this in place before the new year, to make sure you have electronic payments. If you do prefer paper checks, we can also discuss that as well. So first things first, so a member, how do you identify a member as an HPSM member? So HPSM members will have these IDs. They look like this, and they have been advised in 3 letters that we've sent them that this is the card that they will need to show when they make visits in 2022. We do know, however, that a member might forget about the transition or might not show you the card when they see you early on, especially in January. If this does happen, if you might mistakenly bill Medi-Cal Dental, it will be denied. And the reason for the denial will say that they're an HPSM member and you have to bill us. So at that point, you can just resend us that claim and we will pay you directly. Next, regarding the acceptable forms that we will be accepting, we'll have the ADA form, any version 2012 and later. The ADA form is preferred, but we do understand with the transition that you're used to using the Medi-Cal Dental form for your patients. So that also will be allowed, but we are hoping to phase that form out, but we will definitely allow it for the first year. Next, so where to send dental claims. The mailing address for paper claims is listed here, HPSM Dental, PO Box 1798 in San Leandro. The payer ID for electronic claims is working with Dental Exchange Clearinghouse, and the payer ID will be HPSMD. And again, for everyone joining, we will be sending out these slides to you in an email after the presentation as well. And then another important note that's different from Medi-Cal Dental is attachments for treatment are only needed to submit with pre-authorizations. Meaning if you do a billing like a composite, I know with Medi-Cal Dental, they require you to send x-rays for certain treatments. You won't need to do that unless it's for a pre-authorization, but I will also be talking about pre-authorizations in the next slide. The pre-authorizations, this is a big one, so I'll go over it, and again, I'll email this to you. But for the first 3 months of 2022, pre-authorizations will not be required, but we encourage providers to work with the HPSM dental team to ensure connectivity and understanding before the grace period ends. So why will authorizations not be required? This will be really to avoid disruption to care and to give providers and members time to adjust to the new benefits. And then what do we mean by encouraging providers to send authorizations? It is important that providers understand the benefits. I know they're pretty complex in the Medi-Cal Dental Handbook, and to know what is this authorization process helps us ensure payment for services that you provide. This is especially for providers that are new to the authorization process, like the FQHCs, or new to understanding Medi-Cal dental covered services. The dental team will want to work with you throughout those first 3 months to really make sure you have that connection and understand the auth requirements clearly. Lastly, for orthodontic providers, because ortho is such a major care and it lasts over years, you will be able to continue care for any patient that's currently in ortho treatment. But for any new ortho cases to start, we do ask that you still complete the handicapping lingual deviation index score sheet and send that to us, and we'll be reaching out to our ortho providers separately to go over this process and make sure it's understood. Next, these are some of the important pre-authorization forms. So the first one is the prior authorization list. This is a list of all the procedures that will require or need a prior authorization with HPSM Dental, especially after the grace period is over. This list will be important to have, and it will be on our webpage as well. In addition, the justification of need for prosthesis form. This will also we'll also providers will also be using this form with HPSM Dental. We are, however, making our own version of the form, and it will be the same information, but we'll send that out to you soon. It will be available on the. Oh, sorry, if you could go on mute, please.
Because that for that place it has to
be. Anyone who's in the video, can you please go on mute?
I know what to do. No.
Okay. Okay. All right. Sorry about that. Okay. So the justification need for prosthesis form will be an HPSM provided form. And we do advise the provider during that grace period, this is meant to say, during the grace period, we will advise you to still complete this form and keep it on your record for when we do any chart audits that we'd want to see the history of their need for the prosthetic, for the denture or appliance. The orthodontic form, again, is going to be that same California index score sheet, and ortho is something we definitely, throughout the 6 years of the pilot, we want to address to improve how the benefits are being provided and what is allowed. So we'll definitely follow up with the orthodontist on how we want to work on that. So now we have some information on emergencies, retroactive authorizations, and urgent authorizations. So when the authorization grace period ends, if emergency treatment is needed for a service that is listed on the HPSM prior authorization list, the provider is advised to, number one, thoroughly document the need for treatment and keep necessary pre- and post-operative records. This will be including but not limited to pre- and post-op x-rays, perio chart, intraoral images, and really a detailed narrative of the need for the emergency care and why they could not wait. Next, that will advise you to send the retroactive authorization to HPSM by writing in the remarks or comments tab of the authorization form that it is a retroactive authorization for date of service, and then you'll include the date of service. And then if a patient comes in with urgent needs, but it's not really emergent where they need it in that day or they could wait, we do advise you to send an urgent authorization. These urgent authorizations will be processed in 72 business hours, and when you Next, regarding the dental benefits, so all services currently covered by Medi-Cal Dental will be covered services with HPSM Dental. authorizations after the grace period. The dental director will decide requirements, and we will communicate requirements at our next webinar in February 2022. The frequency differences for year 2022, one to note is fluoride. Both will be covered 3 times per year for all members. Now, the current providing is for adults, I believe it's once per year, and for children it's every 6 months, but this will be 3 times per year for all ages. I'll also be providing you all with the dental benefits cheat sheet. I reviewed with some of you in this meeting, but it is basically it goes over some of the most common dental services that you provide in a general dentist office and what the frequencies are, if authorization is required, and more details about specific CDT codes. Now I'll be talking about some details about the CalAIM and incentives. So with CalAIM, one of the new benefits of it is a CRA bundle. It's something that was in DTI and other counties, but it is new to San Mateo County. So CRA is Caries Risk Assessment, and the bundle that they have is essentially when you see a member, you're going to, first thing first, you have to take a training that is provided by CDA. This training is available now, and it's actually no charge. So we do advise providers to sign up for this training now because there is a $200 fee after this year. But when you do sign up, you'll have 90 days to complete the training. So as long as you sign up in this year, you'll have 90 days to complete it. The dental team will. The dental team will reach out after that 3-month grace period to verify the CRA certification and ask that you send us a copy of it. Is really the importance of the importance of the CRA training is that it will give you forms that you'll need to keep on record, where you will narrate the risk of caries for that member and keep it on file. You will not need to send it to us, but you will need to keep it in your patient's file. In addition, based on the level of risk for your patient, if they are a high-risk patient, you're able to document that in the CRA form. If they are a high-risk patient, you will be able to see them every 3 months for increased frequencies for cleanings, exam, and fluoride based on this level of risk. If someone is moderate risk, you can see them every 4 months for all of these treatments. And low risk, you can see them just every 6 months and bill out for these 3 procedure codes and these 2 all in a bundle. And again, the dental team will reach out after the 3-month grace period to verify CRA certification. Other CalAIM updates is the SDF coverage for all ages, and additional increase certain preventative services by 75%. There will also be additional incentives decided by the HPSM Dental Steering Committee members, and we will implement these likely in year 2023 or 2024. Next, I'll go over the referral process. So here is a copy of our referral form that will also be available on our webpage. This form will basically have the basic information of the member, the clinic information, and the need of the service type. You'll mark here if they need to see an endodontist or oral surgeon. You mark here if they need to see both. You can mark both. You'll mark which teeth are impacted. If they have any other pre-authorizations that are under request, and any other comments you can add here. When you fill out this referral form, you could email it to the dental team or fax it to us. And really, this form is only when you need help finding a specialist for your patients. We do encourage in-house referrals when possible, and we do allow for general dentists to provide specialty care like endodontic care when able to. And then next, I'll talk about Proposition 56 payments. So this is something that is definitely new for all current Medi-Cal dental providers that are not FQHC providers. But I'm sure you're familiar with Prop 56 payments, and as a contracted HPSM provider, you will still be allowed to have those payments, but the way you receive them will be different. So all contracted providers will receive supplemental payments quarterly via a check and paper RA in the mail. The information in this, so essentially we're going to capture every service that you had provided in the past 3 months of the quarter and which of those services were related to a Prop 56 payment. And we will send you a really detailed summary of this, which includes the claim ID that's related to the member demographics, the date of service, the CDT code, the rendering provider name and information, and also the paid amount. So it'll be really detailed that we'll be able to see for which services were included for the Prop 56, and we could also send you or work with you to send more detailed tallies and reports of these payments as well. And the reason Unfortunately, HPSM's payment system is not currently capable of paying Prop 56 electronically. This is the same for our medical side of our medical providers as well, but we are looking into ways that we can incorporate this option in the near future. Unfortunately, this will be what we will do for the first year, and we'll see how we can improve it going forward. And then here's some information about the provider portal. So once your providers are fully credentialed and the contract is fully executed, you will be able to log into the portal and search eligibility. For members, you can search by last name, by HPSM ID or Medicare ID. And then you can also check on claim status and authorization search. And we can also provide your office additional individual training as needed to go to work in the portal. The login allows for an unlimited number of end users per practice and/or location, and each person who uses the portal must have their own individual login. Next, just to kind of summarize some of the key differences between HPSM and Medi-Cal Dental, we have the higher payment rates of 30% starting out in year one and no annual maximum. We have less authorizations in Medi-Cal Dental. We'll have a quicker turnaround time for authorizations. We will process them in 5 business days for anything regular and 72 hours for urgent. You'll have local support from our dental team. You'll know who we are. You can reach us anyway. You can text us, call us, and we'll help you with any troubleshooting or anything that comes up. Really, and just the main highlight is the improved integrated care coordination for our members. We're looking at the whole person, their overall health, how their medical health links to their dental health, and really just seeing how we can improve overall health and make some really big changes in the community. The next steps, the dental team is going to reach out to understand your schedules and how we should refer members to you and what you prefer. Pending contracts will be fully executed in the next 2 weeks and sent to providers. The dental team is ready to troubleshoot and answer questions when we go live starting that Monday, January 3rd. Any questions that come up, you need to verify if members at HPSM, you can email us and let us know. We'll work with you. We'll be ready. Our next informational webinar will be in February 2022. We will provide an update on the pre-authorization grace period, and we'll likely have the dental director to join us in that webinar as well. If you have any questions, again, please, and any personal questions about your office, please feel free to reach out. I am available for meetings throughout the rest of the month. And then we are, actually, we did get an email today that we are ready for electronic claims testing now. So I'll reach out to a few of you today to see if you can send some electronic test claims to our DocuStream vendor. And I know that was a lot and I talked really fast, but does anyone, we'll start with some questions now. Did I do that great of a job? Let's see, we have one question here. So for ortho, does the process stay the same? Essentially, yes, for ortho, you will still need to complete that form, the score sheet of the 26 points form. But as I said, we do want to find ways that we can improve that even by reducing the points needed. And we will definitely reach out to our ortho providers specifically to talk about that transition for you. Is Bay Area Dental Surgery Center? Yes, they will be. Them last week, and they are filling out the roster now. So they are definitely going to be on our network, and really excited that they'll be able to send both medical and dental authorizations to us. I'll just do coverage. Like when a member has a private insurance that they're paying for, and also HPSM Dental. HPSM Dental will essentially be not quite a secondary, because if they do have a primary insurance that they're paying out of pocket for, that would certainly have higher fees, and Medi-Cal would pay the lesser of those fees. So if someone ever does have dual coverage, we'd encourage to work with our dental team, and we'll understand the benefits that they have of their primary and what your specific questions are on what the coverage is. It's covered as medical. Do the same treatments require authorizations? Yes, there's some that one important note of authorization that's not required is for deep cleanings. Those will not require a prior authorization. And when you do complete them, you just send in the service code, and you don't need to send any supporting documents, and we'll just follow up if we ever audit for those treatments. Is 6-month gap between recalls strictly 6 months?
A lot of participants, 23.
Sorry. Okay. It 6 yes, I think I'll check with our claim. I think we either set it up for 6 months or 2 times per year, but depending on yeah, do you have us I'll double check on that. I know we went back and forth on doing it every 6 months or if we wanted to do 2 times a year, so I'll get back to you all on that, especially Sam, about the 6-month requirement. Are age limitations the same as Medico? Yes, the age limitations are the same. Any oral surgeon? Yes, we do have some oral surgeons at some of the FQHCs. We have oral surgeons with another corporation that has an ortho, and we do have Bay Area Dental Surgery Center that you mentioned. Pediatric rarely need a pre-op. Yes, correct. For pediatric, it is the same. Our benefits will be less restrictive than Medi-Cal dental, so anything that currently requires a pre-auth will be the same and nothing more than that. It will likely be less that is required. Do you have a list of referrals that we can use? Yes, we will. We will have a list of specialty providers available, and we will have that on our webpage, and also, but we will encourage when members do need to find a specialist to link them with the dental team, and we'll be able to contact with the schools. We have direct contacts there, so we'll be able to really find them a match soon. Will we be able to log in to find a specialist? You won't be able to log in to find a specialist. I think it'll be mostly emailing the dental team to let us know when you need help finding a specialist, and we'll kind of take over and help them find a match. But we will work with you and let you know who we match them with and who you prefer. That if you have someone you like to refer to, we would want to encourage we keep that process for you. And we do encourage you, if you have someone that you do refer to when they are in network, like Bay Area Surgery Center, you can definitely just send that referral directly to them. Sam, I can give you some more information on the name of some oral surgeons, Sam, on another. Yes, we do have some endodontists, especially at the schools and some of the FQHCs. UCSF, I know they have a big wait period, so we are working with them to see how we can open up access, especially for our HPSM members, and really just having the direct contacts at UCSF and UOP, I think will help us find matches and get more care quicker. Are the benefits the same as Denti-Cal? Essentially, they are the same, as I mentioned in some of those other slides. I think some of the main differences is the benefits are the same, but the main differences are the payment rates, the less authorization requirements. So some things aren't required to authorize. Another change is that you won't need to send x-rays for things like fillings. You won't need to send images for all those things. You can just keep a record of them. And really just only time you need to send attachments is for authorizations to make sure we have everything we need. Is fast attach capable? Yeah, is that the NEA fast attach? We will be able to get attachments that way. Any reimbursement for PPE? Right now, we will not have any reimbursement for PPE. You will be able to get the provider login for the portal once we have your contracts fully executed. As I said, we are planning to, with our consulting dental director approving applications really quickly this week. We will have that login and be able to provide you the final contract soon, and hopefully for sure by the end of the month, we will be able to give you the provider login for the portal. Is there a provider? Yes, there is a provider handbook, and I will also be emailing that to you when I send you back the final contract. So no x-rays needed. Correct, Malu, no x-rays needed for fillings or attachments. Only attachments needed for pre-authorizations when you send them, but not for things like fillings or SDF. You won't need to send pictures. You can take the pictures and bill us for them, but you don't need to send them. Fast attach for both claims. Yes, so you can do fast attach for pre-auth, like I said, claims. Claims will not, you will not have to send authorizations. If you do, for some reason, that's fine. But definitely you can use fast attach to send attachments for both. For ortho, we would have to send physical models to Denti-Cal. Will we continue to send models to your PO box? Oh, that's a great question. Thank you for bringing that up. I will, I believe you will definitely send them to HPSM and not Denti-Cal, but I will follow up with you, Gail, to let you know an exact address for that. Where can we get a fee schedule? Lucy, I can email you. I will email you all a fee schedule that we have in an Excel format, and also send you the link for the Prop 56 payments as well. Missed any other questions? Great. All right, so after this call, I'm going to send you all a copy of this PowerPoint. I'll send you all a copy of the fee schedule, and I'll also send you a copy of the draft of the dental benefits cheat sheet that goes over some of the main, some of the most common dental services. Do subscribers have a beneficiary ID number? Do subscribers? I don't know how. Typically, so even for children are typically listed as primary subscriber because it's their insurance. So they will not have any beneficiary number if I'm understanding that question correctly. What is the turnaround time for payments? Generally for payments, if they are sent electronically, it should be sent within pretty quickly. I say like 4 to 7, around 7 to 14 business days, but definitely could be a lot quicker when electronically sent with everything we need. Do we need auth for dentures and crowns? You will need an authorization for dentures and crowns after the grace period of no pre-authorizations has ended, but we will advise you for any treatment that you do during that grace period, you need to keep really documented information about the services you provided, and still for dentures, still complete the need for prosthesis form. Can you show us how to verify eligibility? Yes, I can. So it was pretty easy. It really was just this. It really was just this on the portal. I mean, it's really simple comparatively to like Delta Dental when you log in their portal. Really straightforward. Here's eligibility search. Here's office management, which shows you a claim search. So you can search by number and also auth search. But this is how the eligibility search will look. You pull up eligibility. You can put the patient's last name, member ID of HPSM, or their Medi-Cal ID. You can search and it will pull up a list of the patient. And then let's see, can you provide EOB in electronic format? That will help. Yes, we will have the claims EOB will be in the portal. Do we claim HPSM as primary insurance and Denti-Cal as secondary? Oh, so actually with HPSM members starting January, they will not have Denti-Cal. So all current Denti-Cal members in San Mateo County will just have HPSM dental benefits starting January 1st, 2022, and you'll send all claims to us and not Denti-Cal. Do we need to start a new fee schedule? Yes, you will. I'll send you the fee schedule, which shows a 30% increase in fees. So I will send you that. Can we report failed appointments through the portal? Just Sam, good question. So I know currently with Medi-Cal Dental, you're able to report failed appointments through their portal. I think our system will be that you'll email the dental team. Maybe if you want to do like a weekly, letting us know who didn't show up for their appointments, because we do want to remind members that they should keep their appointments. If they cannot make their appointments, we do want them to let providers know. So I'll definitely send you more details on that, Sam. And any steps to decrease? Yeah, I think really just improving member education as we're doing more with dental, letting them know about the benefits and just reminding them of the importance of keeping their appointments. And if they cannot make it, to let them know or let our dental team know, and we can call you. This is especially true for any specialty services that they need. So we'll definitely do more to encourage our members and educate them to keep their appointments. Is there a number to verify eligibility if the site is down and not working? Great question. Yes, I would. If the site is down, you will definitely let the dental team know. And then you can also call the dental team and we'll figure out what the issue is. But to my knowledge, I don't think that the site has been down and not working for long periods of time. Do we send medical ID number or HPSM number for claims or pre-auth? Great question, Vicki. I believe you can do both, but I'm going to double check on that. But for sure you should do HPSM number, but I'm almost like 90% confident you could do both, but I will definitely confirm that. Dental team contact information. Oh, great question. I will also email that. I'll email that to you and email while sending these slides and some other information. But I think you all have my information, and I'll also send you Gina's information. Then Bernadette will be joining us next week. Oh, thanks. any other questions? I know I have to get back to you on some of these, but this is really great. So thank you all so much. Can you please? Yes, Lorraine, I will definitely send you a link for the recording as well. And I'll let you know when it's live on the provider web pages. Yes. Is the eligibility month by month like Medi-Cal? I believe so. I know it's just based on what we get from the state. I know that they update it. I believe it's monthly. Lucio, I'll double check on that and confirm it with you. Do members have full benefits or do members have full benefits or will they have a social spend down restrictions like emergency? So they will, all members will have full HPSM dental benefits. I'm not sure what the social spend down is, but also for emergencies, we will allow for any emergency care and retroactive authorizations. But do members have? So yeah, most all HPSM members that you will see of ours will have full HPSM dental benefits with us, but I'll follow up with the social spend down part. Oh, share of cost. Okay, sorry. Do members have full? Oh, I see. Share. Yes, Sam. So I know we had talked about this a little bit with the share of cost. You will. I know it's. Yeah, it's hard to explain, but I know for some members now, currently on the Medi-Cal dental site, you're able to see when they have a share of cost and you collect that and then you report it to the state. It will essentially be the same with HPSM, but it is that a lot of our members will not have a share of cost starting 2022. But we'll definitely, I'll follow up with you, Sam, and all of you just to kind of understand the share of cost fully, what the exact answer is of how you can check it. And what it would show on our HPSM site if they do have a share of cost, so I will definitely verify that. Okay. Dentico members outside San Mateo, we still accept them. Yes. So any like San Francisco County Medi-Cal dental patient, you can definitely still see, and you'll just have to bill Dentical for them like you regularly do. And then any of our members can also, San Mateo County members can also go to any county, and any provider in different counties can also credential with us. Are upgrades allowed for exam zirconia instead of PFM? I'll double, not to my knowledge, Sam. I think right now we're not changing the crown benefits, but we will hope that we can improve them, especially for adults. But no upgrades for that right now. Is there $1 copay like Dentical? Oh, there shouldn't be a copay. There is this might be the share of cost you're referencing with Dentical, but there should not be a copay with HPSM dental for any covered service. If there is ever, a treatment that you're recommending for a patient that's not a covered service, you're definitely allowed to work with that member to agree to a payment plan with them and just have something in writing in their chart that you what you recommend, and that patient agreed to have services and pay you for them. Just checking if I missed any. Did you say? Yeah, no, Sam, I think PPE will not be reimbursed. You mentioned SRP is covered a benefit without authorization. Does this include LDA and irrigations? That's a good question. I don't know what LDA is, but I will check on that. And irrigations, I'm not sure if irrigation is currently a covered benefit with Medi-Cal Dental, but I will check on that. If it is, anything that's currently covered by Medi-Cal Dental, any service will definitely be covered by HPSM, but I will double check on the irrigations. No, that's not commonly covered, but I'll check on that. I want to clarify, no dollar copay. Lucille, correct. I haven't heard, that hasn't come up about the dollar copay, but I will definitely follow up on that and let you know if I'm mistaken, but to my knowledge that there is no dollar copay. Of course. And again, any other questions that you all think of after this meeting, definitely just send an email, or like I said, we can always find another time to meet. I'll be here throughout the rest of the month and not taking any time off. We provide, yes, we will definitely, when we have that ready, we will provide a list of specialists that will be in network. We're still verifying with the state if we can have a separate just dental network, provider network, like to provide to members, and also just a separate listing on our page. We're still waiting for the clearance from the state on that, but we will have definitely some sort of list we can provide you of the specialists that are in network. Each member is their own. Yes. Yes, each member is their own subscriber. Any other questions on anything? Anything you can try to put myself in your shoes of an office manager and kind of thinking of what you need to know. So how do offices create logins? So yeah, great question. So once we have your providers, at least one of them fully credentialed and the contract fully executed, you will be able to log in the provider portal, and you can have multiple logins for each of your staff members. And that will be definitely by the end of this month. And hopefully by next week, we will follow up and I will give you all an update on when you can access the portal. Can we check eligibility by social? Great question. I'll check on that, Sam, because here it's saying no, it's saying, but you can definitely search by last name. If you just put like a basic last name like Smith, it's going to pull up all the Smiths that are HPSM members. But I will check on SSN because that should be important to note. Can a dental office enroll this program if it's not enrolled? Yes, Lucille, they current providers that don't currently accept Medi-Cal Dental can join our network and not be fully enrolled with Denti-Cal. They can just be HPSM members in San Mateo County, and we would essentially keep their records on file for the state on their behalf, but they would not have to fully enroll with Denti-Cal, and they can just join HPSM's network. When will this kick off? Is this 1st of January? Yes, this will be January 1. Any patient, any member, HPSM member you see, you will send the claims directly to us. Is that the same with individual providers? Yes, Sam, is that, I think you're referencing, is it the same for individual providers to join the network that aren't currently with Denti-Cal? Yes, so if you have any providers in your office that aren't currently enrolled with Medi-Cal Dental, they can still join HPSM's network. What is required by the state is they want the providers to fill out the Denti-Cal application, and we just keep it on file, and we don't formally send it to Denti-Cal. We just keep it on file that we have that information that they need. So patients, yeah, essentially, Malu, definitely their preventative and diagnostic will be reset. So any cleanings, x-rays will all be new. And then for any major services like dentures after that 3-month period, we might be looking at, just making sure they haven't had any in the past like years. That hasn't been too soon, but we're really going to decide that when we have our dental director and what they prefer. But overall, like cleanings and everything like that will be reset by January 1st. When we verify eligibility, is that how we check history? Oh, great question. So yes, you will be able to check history on the portal. However, because right now they don't have a history, we won't have the history of what what they're doing this year. But after you start seeing that member, say you see that member in January, when you go in February, we'll be able to see the history of services you provided them. And then if you do have any new members coming to you, say like next, in the year 2023, you have someone who's switching to you, what you can do is let the dental team know you're having a new HPSM member, and then we can run a report to see any recent claims that they had in the past year and let you know what their frequencies are at that point as well. It's really great. I'm trying to think if there's anything I missed that I wanted to go over with you all. Yeah, just again, I'll also be sending you all the CalAIM stuff just to make sure you sign up for that training so you can complete it in the next 90 days at no charge. It really just goes over some of the forms you use for that CRA process. Is there an appeal process? Yes, Sam, there is an appeal process, and we will definitely have that. I think we'll create like a one-pager where we'll just give you information on who to contact when you have for appeals, and we'll definitely have that information for you. But there will be G&A for providers and for members, which is definitely new because with Denical, they currently don't have that. So is there an approval process? Wait. Oh, how long does claims allow for submission? Oh, great question. I believe it should be submitted after 6 months. The payment rate goes down, so you have to send it within 6 months, but I will definitely verify that and send you that as well. Let me just write this down. Do you provide translation services, and are they? Yes, we do have translation services available, and there are not limitations for usage. And we'll provide that. We'll provide you information on who to contact when you need translations as well. Are they over the phone or in person? They are. I believe we can do both, but majority are over the phone. But for ASL, we do have in person available. Of course. What member may call? If eligibility issues come up, members will be advised to call either member services or their Care Advantage member services line, which they know on their cards which numbers to call. When they have eligibility questions, if they need help matching, they'll be able to reach the dental team. Do we need a copy of their beneficiary card for claims? You do not need you don't need like a physical copy of it. If they're able to give you, if they have it, if they know their ID and they're able to give it to you and you're able to search online and verify that that is them, then you do not need a physical card. Is there transportation provided? Yes, Sam, there is transportation provided for members like with Uber, and also for non-emergency medical transportation for members in wheelchairs as well. And members can call member services to get those services and coordinate rides when needed. What can we do more to make this program a success? It's a great question. I think you're all already doing it, just seeing our members, our members have said such great things about everyone, and I think really just communicating with the dental team when you need to. If there's ever any issues that come up, any member, questions that come up, or anything that you think is of concern, or any suggestions that you have on what we should improve, definitely just communicate with us. I think we can do some monthly check-ins or something, or really just kind of be a team. I know this is something so new for a dental insurance to have when you call MetLife and Delta Dental, you're routed to who knows who. And I think by knowing us, and we know that we have the same goal of really just improving the patient's dental care, improving their home care, improving it so you don't have to do all these emergency treatments, really just communicating with us, being available for patients. That's really the best way. What are metrics at HPSM? Great question, Sam. You know what else? I can also send you all the evaluation design that we have for the 6-year pilot. It really goes over what our goals are for utilization and access for our members. So I can definitely send you all that as well, because it is really important to understand. So I'll send you that. So I have a lot to send you after this. any other questions? It's been really great, so thank you all. Thanks. Did you say NEA is ready to go? Yeah, the electronic claims testing is ready to go. They just sent an email before this meeting that they'd like our providers to send at least a few dozen. So the few that I have been kind of talking with, I'll definitely let you know all the information and where to send it. And then we also will, I think we'll first just double check the sending just electronic forms without the attachments, and then we'll go ahead and test with the NEA as well. Because I think HPSM will have to have our own login to access those NEA attachments that you send. So we will definitely want to test that this month as well. Is NPI our provider ID? I'm not sure about that. I think you might have a separate provider ID with HPSM, but I will double check on that, Sam. It's a great question. Or will you give us a separate one? So yeah, I'll double check on that, Sam, if you have what your provider ID will be, if it'll just be your NPI or if you have a specific HPSM provider ID. And I will have access to all these questions, so I promise I'll follow up on them. Thank you. Just give it like one more minute if anyone's thinking of any questions. All right, perfect. So is there? Yes, no, I will definitely provide you all the answers for these and that. Like I said, I'll be able to access these and I'll make sure I provide you all like maybe just a brief FAQ just to summarize some of these questions. Is there emergency medical equivalent? Wait, is there emergency medical equivalent, and what are the restrictions? Are you just asking what the process is for emergency visits? This is kind of reviewed briefly here for emergencies and retroactive authorizations and urgent authorizations. We will allow for emergency care when needed. That requires an authorization. You just send us the retroactive auth, stating why the service was needed emergent. That answers your question. Right now, if a member is qualified only for emergency, oh, I see. We are allowed to do check tooth. Okay, I'll get back to you on that, Sam. That's a great question, though, because I got members are only qualified. Yes, definitely, Jennifer. I think it'll be good that I have all these questions here to access, and I'll just respond to each of them just to kind of have it in writing. So I'll definitely provide you that. Maybe not by today, but definitely by tomorrow or this week for sure. Or I might actually wait because we're having another webinar Friday, but we'll also need for this one. So yeah, but Sam, I'll get back to you on that emergency one and what that is, and then how long does the claim processing take? So Vicki, when you send claims electronically, it will be pretty quick within about 7 to 14 business days that we process them. Frequency for 21 and up is 6 months for a year. Frequency for recall cleaning, it will be 1 year. I know that's something that we do want to, providers have said to change every 6 months, but for the first year, it will be still once a year. But if they do, need deep cleanings, you're definitely encouraged to do the deep cleanings and have more frequent PMT recalls. Do you see any budget limitations that you could scale down this program? Budget limitation. I don't see any. Yeah, I don't see any budget limitations to change anything that we're currently having with the program as it's laid out. No, we have the increased fees, so nothing is going to change or but nothing will be more restrictive definitely than Deni-Cal. Moving forward, it will just get improved. Are PMT recalls included in the fee reimbursement of SRP, or is it separate? It will be separate. So if you see a member for an SRP, you'll see them for the deep cleaning first, and then you'll see them on the regular recall for PMT, but not on the same day. Do you have a handbook of this program? We don't have an actual handbook like Deni-Cal. We will still advise you to reference that handbook, but I will definitely outline the differences in that cheat sheet I'm going to provide you. Especially the main difference is that the deep cleaning doesn't require the authorization is one, but I will definitely outline the differences, and well, hopefully down the line, I'm sure we'll have a separate dental like handbook, just like Deni-Cal, but right now still follow that handbook for questions, and then any other specific ones, just reach out to me. CalAIM incentives will be paid by you. CalAIM incentives will be paid by us, and we'll pay them at the claim level, like the 75% increase on certain fees. You'll get them right when you send the claim. It'll be embedded in the fee. So it won't be like a separate bonus payment. It will come all at once. Can you address credentialing timing if application is still pending with HPSM? Can services start? Yeah, great question, Jennifer. So how advising members for members that have groups, as long as we have one provider that's fully credentialed and approved in a group, the whole group will be able to see members at that higher rate starting January 1. Probably once a year in Florida, 3 times a year. Correct, Lucille, yes, for adults. But we will be reaching out if there is an issue with any of you not having the higher rate or not being approved by January 1, we will reach out and let you know. But as far as my knowledge, we are that there's some issues with verifying schooling for those who go out of country, but it's not limiting anything to provide care by January 1 and be paid at that higher rate. But we are we'll reach out when we need to for additional information. Let's see. Exam for adults is once a year as well. And again, I think a lot of these will be included in that benefits cheat sheet. And I'll make sure if when I do send it, if all of you have any suggestions of other services to include on the cheat sheet, let me know of anything that you commonly do. I might, include something like space maintainers or anything that you do frequently in your office. Let me know and I'll add it to the cheat sheet just so you can reference it and your team can reference it quickly. What's the time period for credentialing? For credentialing, once we do get like the application file from providers, it could be as quickly as 1 week to 3 weeks to approve the credentialing application. So as long as we get all the information that we need in the file, it will be about a week to approve a credentialing application. CRA related issues are concurrent with recalls, right? Yes. So you can always send the CRA bundle whenever you have the recalls for them and relate it to that, the level of recall, the frequency levels related to their risk. All frequency are the same with Deni-Cal. Correct. For now, Lucio, I'll let you know. The one thing we're looking at is the SDF frequency. It's every 6 months. It's going to be every 6 months with Deni-Cal, but we're seeing if we're going to not restrict it, but make it more like every 3 or every 3 to 4 months. We do want to go based on. We do full X-ray probing exam for high-risk children every. So no X-ray Sam. So when you see a member, so let me go back to that slide. Okay, so the only thing related to if they are high risk, you can see them every 3 months and you'll bill the CRA and the nutritional counseling, and then you can also bill for cleaning, exam, and fluoride. So the x-rays won't be every 3 months, but they'll be the same frequency as, if they need a PA, you can definitely take it. But just for, so a bundle, when you see a member who is high risk, you bill out for CRA, nutritional counseling, cleaning, exam, and fluoride all at once. Topography, exam. Yes. And fluoride. Forgot fluoride. Perfect. All right, and now we're down to the last few minutes. any last minute questions, and like I said, I'm going to send you all have access to this presentation. I'm going to go back and look at all these questions and answer them, just write it out so you all have it. And then I'll also be sending you some slides, the fee schedule, the CalAIM information, the evaluation. So I'll send you all that who's in this meeting, and then you can forward it to any other staff. And then, like I said, any other questions that you have, any meetings that you want to have, we can do a quick phone call. We can do anything before January 1. I know it's right around the corner, and I know it's a really busy time, so do appreciate all your help with this. And if anything else comes up, please reach out. I'll also be sending you all the contact information for our dental team, and really excited to announce who our dental director will be soon as well. Oh, yes, Jennifer, thank you for that. There will be an additional webinar this Friday from 12 to 1 as well. Oh, perfect. Thanks, Larry. Awesome. All right, so we are a minute away from 1 o'clock. Thank you all so much again for all your questions, for all your support throughout all this, and I will definitely get back to you by this week to answer these questions and send you all that information. I'll send you that information now, and then I'll get back to you with these questions by this week. And then if there's any other questions that come up in the Friday meeting, I'll also let you all know as well. And again, just reach out if you need anything, and we really appreciate all your support. So thank you all so much. And have a great day.